Good morning, everyone. It's Wednesday morning, and I'm just about to go into work. But I thought I'd reply to last week's discussion today, so that I can prepare my mind tomorrow for the next lesson going out. Yes, last week was Kath and Emma speaking about nursing patients in coronary care. Surprisingly, I got some of the longest contributions for the material in that lesson, and it was incredible some of the overlap between the things that were said to me. Yes, communication problems in coronary care. You're quite right, hearing a lot of different types of information from a lot of different types of sources. That would be confusing at the best of time. If you were getting a carpet fitted, it would be hard to take numerous different sources of information. But when it's your mum or your dad or your husband in with a life-threatening condition, potentially a life-threatening condition, receiving information from different sources can be, confusing is the least serious word that I would use. It can be disorientating. And if you add to that, that people have got to sit through a crash course in coronary artery anatomy and physiology, it's easy to see why people's communication problems might build up. If you've ever been in this situation yourself, you will know that it's possible to become confused even by the differences that people have in their face. What I mean by that is that family members will sit there and they will notice that one of the members of staff doesn't give as much eye contact as another member of staff, for instance. And it will be easy to build up the idea that that member of staff knows something that they're not saying, even though this might be just shyness on the part of the staff member. Not only is the poor person confused and disorientated, and the family members sitting around are confused and disorientated, then we've got the question which was also raised in the discussion about jargon and about complicated sound and new concepts that they've got to get a grip of. Now, we point the finger as nurses, at medical staff here, and to an extent I can understand why that's the case. Sometimes as a nurse, when you go in to meet family members or you're talking to a patient, you will get the notion that one of your roles in that meeting is to act as the translator, is almost to act as the source of subtitles for the doctor. The doctor will go in and give a complicated a complicated explanation about cardiac output and about medications and alpha receptors and beta receptors, and the poor patient's family will sit there with a sort of bewildered look. And when the doctor leaves the room, then you've got to put it into real English that they might understand. But we use jargon just as much, and we have other things. Nurses have other things that might confuse and mystify patients. For instance, patients find it very difficult to understand why it is that they have to fit in with an institution schedule. The nurses manage and run the institution schedule, but patients sometimes find it takes a while for patients to become institutionalized and to understand that the world isn't working by their clock, but it's about working by the institution's clock. That's a difficult one to get over. On the question of printed materials, I raised with Emma and Kath. It's interesting to see that many of you mention the use of British Heart Foundation booklets. Now, one of the advantages of using written material, I suppose, is that while a spoken communication might be misunderstood by the patient who's in fear or who's in pain, If they've got a booklet by the bedside that they can refer to again and again, then this might assist them in remembering. These are very accessible books in contrast to our use of jargon and to complicated medical terms. These books are written in plain English and in a way that patients and family members might understand. Also, it might give the family members something to read during visiting times, and visiting times are often stressed periods for family members who might run out of things to say. Perfectly comfortable at home, but now they're in hospital, rather digging around looking for something to say to Dad. Interesting that somebody mentioned the use of DVD material. Again, very interesting. DVD on TV. TV is a format now that everybody understands and can relate to. And again, might do something to divert attention from the patients as to why they are in the coronary care unit in the first place. Why might the patients have difficulty following what's put to them? Well, again, somebody's pointed out that the use of opiates might cloud their judgment a little bit and cause them not to follow what's being said to them entirely. I asked you about the benefits of early mobilisation. Well, and most of you have put your finger precisely on what the issues are here. You've got pressure areas, you've got clot formation, and you've got the psychological benefit of sitting out and feeling as though you're getting back to normal. Again, hard to overemphasise, isn't it? The benefits of sleep. You've got a person who's sick and a person who really needs their rest. And don't forget that patients, even though they've had an infarct, seem unnaturally tired in coronary care units. They seem absolutely worn out, which is hard to understand sometimes if you think that all they've been doing is sitting there in bed. But this is a walloping big event that's overtaken them, and it's no surprise really that they're having trouble staying alert. Let's put it no stronger than that. So another person's drawn attention to the use of written material. One of the advantages being that everybody knows what the score is. We're all singing from the same script, and this is a good point, that we're using language of a similar nature, and the rationale that we're offering for treatments and for problems that the patient might be facing is very similar one to the other. On the question of night sedation, if you've ever tried to get to sleep when you're afraid or in pain, you'll know just how difficult this is. And personally, if I was in an unfamiliar bed in an open coronary care ward and I was fearful that if I went to sleep I would never wake up again, I think I might require something to help me sleep. One thing's for sure, if I lay awake all night worrying about my family members at home and what was going to happen to me, the following day I would feel pretty ratty and pretty inclined to see the world from a negative and jaundiced angle. So for me, if ever I come onto your unit, please don't hesitate, go up there and sort me out with a bit of temazepam, because I'm sure I'll need it. Thank you once again everybody for those contributions this week. I'm making a mental note of the ones who didn't reply, but we'll look forward to next week. I can't remember what next week is now, but I'll be sending you this video reply, and we'll see how you get on. Keep up the good work, everybody. I've started to receive drafts of essays now, and I'll look forward to seeing them flying in the not too distant future. Speak to you soon. Bye now.